Okay, guys, today we're focusing on the orgasm, okay? Now, the orgasm is really the centerpiece, right, of the sexual function, the sexual result, right? We want to really make sure that we're getting enough blood flow to that area. And to do that, you got to be healthy, right? You got to try to be healthy. You got to eat and, of course, take care of the circulation to the groin. Okay, how do we do that? Exercise, right? Let's call it Sexercise. We're going to focus on those exercises today, just a few that will improve circulation to the clitoris, the P spot, the G spot, right? The pelvic floor muscles for both men and women. It's very important for us to be able to contract and get the strength from that contraction to maximize the orgasm. Okay. Whenever you are trying to have an orgasm, I want you to remember, first of all, we're going to do some exercises to strengthen the area every day, right? But I want you to also do the contraction and the exercise during sexual intercourse, because that way you're going to enhance the orgasm and enhance the chances of the P spot, the G spot being stimulated and aroused and give you your great orgasm, okay? Okay, so remember, you all know contraction, right? That is what the orgasm needs. And then when it becomes involuntary and out of control and it spreads, then you're having that superb orgasm that we want you to have. But we've got to do some work, especially as we get older, we have kids, when we have vaginal deliveries, that area gets weak. So we've got to do one of my favorite exercises, which is the Kegel exercises, okay? Right. So we talked about circulation. So Kegel exercises is the most common one for the sexual function to be improved in that area. Women, you know, if you've got some leaking, right, during coughing or urination, you're going to have weak pelvic floor muscles that you want to strengthen. Guys, you too, when you're dribbling, when you're peeing and it comes out, drop, 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 and it's not, going smooth and going, fast and strong, you're having issues with the pelvic floor. Again, prostate has to be checked. Remember that, okay? Get your prostate checked. Please, 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 please. So when you're trying to have that contraction, we've got to take care of the health there. And remember, gravity is going to pull everything down, right, with time. So no matter what, you're young, it's going to happen when you get older. You're older, it's already happening, so you got to do things as soon as you can to try and maximize the strength of the muscle so that you don't lose it, all right? Now, I had this patient that came to me. She said she was depressed, and I said, okay, fill out this form. And she filled out the form, and the form said that she's having great sex. And she's like, yeah, I'm fine sexually. I'm like, how can you be fine sexually if you're depressed? Usually with depression, the sexual urge goes away. And she said, Dr. Kathy, I don't ever have a problem with sex when I'm depressed. I'm like, tell me why. She says when she was young, in 15, 16, her mom told her to do the Kegel exercises every second of every day. Yep, every second of every day. So she does that Kegel exercises every second of every day. She comes to me, she says, Dr. Kathy, I'm even doing it now as I'm talking to you. I'm like, wow. Took note, right? So it's hard to do it every day, but I say about 50 times a day. And you can do 25 in the morning, 25 in the evening, or 50 in the morning and 50 in the evening to make it 100 times a day. So that you can actually, again, maximize the strength, the potent contractions of your muscles. Okay? So what do we do to do Kegel exercise? All right, I'm going to do one for you, right? You're going to take a deep breath and you're going to squeeze the muscles of the groin as if you're trying to stop doing number one, doing number two. You grab your muscles of your stomach, the lower muscles, you tighten, and then you relax. And then you do it again. So you're grabbing all the muscles, the anal muscles, the pelvic muscles, the stomach muscles. You're grabbing it really tight, and then you relax. Right? I want you to feel the burn. I want you to feel the pain. I want you to actually feel that strengthening of the muscles as you tighten everything, not just one area, all of them, and then relax. All right? And then you tighten again, and then tighten and relax. Guys, do that with me also, please. This is going to help your sexual performance in the bedroom also. So let's do it again, right? Okay. Grab everything: anal, perineal, vaginal, pelvic floor, stomach, lower stomach muscles. Tighten, 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 tighten. It should hurt. It should hurt. It should burn. And relax. And tighten again. And relax. All right? 50 times a day. 100 if you're really determined to improve it real quick, right? And when you do that, you can do it when you're driving. You can do it when you're driving, of course, carefully. When you're at work, when you're walking, when you're eating. You can do it anytime, okay? And the most important thing is to make sure that it's done properly. I don't want it half done. It has to be done properly. Otherwise, you don't get that benefit, right? From the muscles becoming very strong, okay? And yes, I know it can become a drag, right? Because it's hard to do. So I looked into finding some ways to do it for my men and for my women, for both of us, that we don't have to work so hard. Yes, you have the Kegel balls, right? You can use the Kegel balls. You can put them in there and enhance that squeeze. So you're squeezing, you're walking around, and you are actually keeping them inside there during the day, for an hour maybe. And then you relax, and then you take them out when you're done with your 50 exercises, and then you can, of course, clean them and put them away. Okay, so those are ways of doing it also. If you want a very inexpensive way of doing it, go to the sex store, pick up some Kegel balls, and just grab them. They do have some that vibrate too. If you want those ones that vibrate, that's good too. So the most important thing is doing it how it suits you, whatever works for you. Find a way that you're comfortable with and that you can actually say, you know what, I am going to do this forever and ever, amen. Forever and ever, amen. Never stop, okay? No matter what. And if you're young, do it now. If you're older, do it now. If you're just in between, do it now. It doesn't matter. It's never too late, okay? Yes, your hormone levels should be checked. I'm always talking about hormones. The hormones that are low, it's going to be a hard time getting those muscles tight. The hormones that are a little bit higher in terms of evening out, especially the younger folks, you're going to get more responses. For those that are really, really older and are really having a hard time, get your hormone levels checked. Talk to a doctor like me that will help you get those hormones balanced so that you'll get those muscle responses that we want in terms of the pelvic floor getting tighter. Now, of course, if you're urinating and you're having problems, see your Uro-GYN. I like the Uro-GYN, the combination of the urologist, gynecologist, so that you can get a proper evaluation of how weak your floor muscles are. And yeah, sometimes they want to do surgery, but there are some, lasers and things that they can do before surgery that will help tighten it, put some pessaries and stuff that will tighten it before surgery. So you want to get to someone that will help you tighten the area before surgery. But if surgery is needed, there's no big deal. It's not a very difficult procedure. Talk to your doctor. Talk about getting a Uro-GYN referral for them to go in and fix that pelvic floor muscle so that when you start doing the Kegel exercises, you'll get even better results because you now are lifted up and you're tightening and you're having less of a problem in terms of gravity pulling it down. Okay, and remember, you do want it to be tightened there. Remember my V test. You put your finger up there, open up, see how wide you are. You're too wide, go see your Uro-GYN. Okay, you shouldn't open up too much, right? Maybe a little bit, but not all the way open, right? That's the V test, right? And then you want to do the ruler test. You put that ruler up there too. See how long you are, see how short you are, so that you know how much you can accommodate in terms of penile size and penile length. And that way you'll be able to have better pleasure in the bedroom, okay? So remember, the exercises, the Kegel exercises are to tighten so that you'll maximize your orgasm. If you're not doing Kegel exercises, you're not going to have a great orgasm. And do them during sexual intercourse at the same time. The guys love it. You love it because you get that peak orgasm much better than without doing the Kegel exercises, okay? Now, I'm lazy, okay? I am a busy woman, so I will always try and find a way to get to do the Kegel exercises without too much work. So I've got two devices here, one for the guys, one for the women. Now, two for the guys, okay? So this is actually a device that you can actually use. Guys, I'm talking to you right now, to stimulate the pelvic floor muscles. Now, all right, now this is really, I know when you see it's like, what? This is for the anal area to go up and stimulate the muscles through the anal area, but you can use a device in the perineum between the scrotum and the anus, and you just put it there and it vibrates, and you can actually get that area stimulated in terms of circulation, draining the lymphatics, and getting some motion and some movement and some circulation in there that will help blood flow. Now remember, you also have to do the Kegel exercises with this. So even though you're doing that motion of vibration and getting some movement there with this particular tool, I still need you to do the Kegel exercises, guys. So I want you also to grab tight, really hard, and relax when you're doing this. All right. Now this is the bigger size one, and this is the smaller size one. Okay. And you have the remote that you can use. Yeah, you guys don't be thinking nasty now. This is really for pelvic floor exercises to help with muscles and get that area tightened and get blood flow going so that we can have our perfect orgasm, right? All the time. Okay. That's for the guys. For the gals, this is my favorite one. It's called Yarlap. Okay. Yarlap. And you just connect it to this wire, right? You put the lube that comes with it on here, right? You lubricate the area here that has the plate that's going to send some electrical stimulation. Yes. So I go to the big dogs, right? I really want great results in there. You put it up there. You turn it on, you set it to the one that is comfortable for you. You have to find out the one that's comfortable for you. Just read the instructions, it'll tell you. But I always get the maximum one because I want to get there 20 minutes, 30 minutes, and just get the best contractions you can. But you also should do your Kegel exercises with it in there, trying to get the maximal results within weeks. You can actually see results within weeks. And how do you know? The urination will be less leaking, and you'll be able to know that those muscles are getting tighter every day. Okay. So here's the thing. It's not easy, but for those that are determined to have the best sexual experience and improve sexual function, I'm telling you, you're going to get 2 for 1. You're going to get that great orgasm, but you're also going to get the pelvic floor muscles strong, and then you're going to stop leaking, and then you'll have less issues with, going to the bathroom a lot, urinating a lot. And most of the time when you see that, it's because the pelvic floor muscles are dropping because of gravity. So we need to get that lifted back up. And if you need to see a specialist for surgery, go and see the specialist. And if you don't want to do surgery, tell the doctor to give you other options, because there are other options. And don't always rush into surgery. But if if it's very loose and you really want to get some tightening going, guys love it. Please consider it. It is not dangerous if you have the right doctor doing it, a Euro-GYN. Please go to your doctor and talk to them about it, and you'll see a big difference in the bedroom. Trust me, okay? All right, guys. Nice talk. I hope so. We'll see you tomorrow. Take care. Bye.